Hello, my name is Brittany Pritchett, and this is my Biopsych final project in which I'm going to be reviewing a research article titled Antidepressant Effects of Ketamine in Depressed Patients. But before we do that, why don't we start on the background? So a little bit of an introduction to this topic. There have been several studies done in the past using animals like rats and mice to gain a better understanding of the effects of NMDA antagonists of animals with depression. This research has inspired much more research in which rats were given NMDA antagonists, and the findings were similar to what you would see when treating depression with antidepressants, which is a downregulation of cortical B adrenoreceptors. More research performed in 1993 found that when treating animals, specifically in this case mice, with antidepressants, there is an effect on NMDA receptors and their function. Further research done in 1994 was conducted in which they found that mice who had been given antidepressants for approximately 2 weeks resulted in a significant reduction of their glycine to stop this acid from binding to glycine receptors of the brain. Based on previous research, researchers in this research article that I'm going to begin talking about were curious to see as to if ketamine would have similar effects to antidepressants in human participants with depression. So the methods for the research article are there were 9 participants, 4 were male, the other 5 were female. In the end, though, only 7 of the participants were able to be used since 2 decided to leave before finishing the experiment. Let's see. All of the participants did meet the DSM-5 criteria for depression, and all participants were drug-free and healthy physically. None of the participants were using any medication for at least 2 weeks prior to research beginning. Participants were randomly assigned to receive either a ketamine or saline solution. The saline solution in this case is the placebo. And this study was a double-blinded study, as neither the participant nor the researcher knew what was being distributed and to who it was being distributed to. This was done to ensure that there were no outside influences interfering with the data that was collected. And then for time, each participant had 2 treatment days, approximately 1 week apart, in which they were given the saline or the saline and ketamine solution on a slow drip for 40 minutes. And then there were scales used to measure levels of depression, which were the Hamilton Rating Scale and Beck Depression Inventory, beginning at baseline and then again at 80 minutes, 230 minutes, 1 day, 2 days, and then 3 days after the ketamine or saline was administered to the participants. Researchers also used the Visual Analog Scale and the Brief Psychiatric Rating Scale in order to see if there were any psychoactive results of the ketamine distribution. So that began at 10 minutes, 40 minutes, and again at 110 minutes. And then let's talk about our results. So here's our scale, or our figure here, in which we see the effects of the ketamine on depression levels and on psychoactive levels. And so we see that the placebo is pretty much a flat line, which is good because it, was the placebo. So there were no effects on patients or participants who received the saline solution. But we did see, we actually did see significant findings with the ketamine treatment. So there was, in one figure, we can see that participants did report feeling a little high, or some of those psychoactive psychoaffective results. And then we can also see that they had improved depression levels, which is our results section here. It was found to have a positive effect on treating depression when compared to the saline solution, which participants saw no improvement, luckily, because it's a placebo. And then ketamine also did give participants that euphoric feeling, which we could see on the figure that we saw earlier. So in conclusion, ketamine was effective in treating depression. It was observed to give people a small high, but it did not increase any symptoms of psychosis, which is a symptom of depression. And then there was positive results that were seen after only 3 days of using the ketamine. So a little bit of a review of this research study. I would say that it was a great idea and an interesting topic to explore further. However, I think that there was some weaknesses of this research study. One of the biggest weaknesses that I would say is that it was a really small sample size. I think that findings could have been a lot more interesting. You could have more to compare and contrast if you had a larger sample size. And then this was such a short period of time to research the effects of drugs. I think it was approximately 2 weeks. And so we didn't really get to explore any possible negative side effects to the ketamine usage. Which leads me to my research proposal. First, I did a little bit of background searching on the negative side effects of ketamine, which we can see on the left side here. So ketamine can be highly addictive, and it is actually observed to have negative effects on the brain when used for long periods of time. So chronic ketamine is associated with cognitive impairments like mood disorders, psychoactive symptoms, dissociative symptoms, which we kind of talked about, people feeling like euphoric. That could also be connected to the dissociative symptoms that we see here. And then it was also, researchers also noticed that with a long-term use of ketamine, the brain can experience gray matter volume decreasing. So it's very damaging to your brain. And then here's just like a little fun fact here. Mental disorders like depression are among the most common conditions around the world, which is why I propose that more research is done on other substances that are natural and found just like naturally in the environment, unlike ketamine. So I have here my proposal. I propose that researchers should continue to explore different substances that are natural rather than artificial, as just mentioned, like ketamine. So ketamine has long-term harmful effects on the brain and mood in individuals, which I spoke of earlier. But mushrooms are a naturally occurring substance that can be potentially a great alternative to ketamine in the treatment of depression. Pardon my pronunciation on some of the following words. Psilocybe cubanis is one of the many kinds of mushrooms that have been found from previous researches on animals, like mice and rats, to have a positive effect on depression. That specific strain that I tried to pronounce just now does have psychoactive effects, as it does have psilocybin in it, if the dose is high enough. So you have to take a good amount of it to feel those effects. But there are other strains of mushrooms that have been researched, such as a common lion's mane that does not have any psychoactive effects, but have still been shown to alleviate depressive symptoms in women. So there are so many different kinds of mushroom strains, both that do have the psychoactive chemicals psilocybin in it, but then there's also other kinds, like I mentioned, lion's mane, that does not. Both types that have the psilocybin and that do not have been seen to improve symptoms of depression in people. So my research proposal is that I suggest a longitudinal study with approximately 50 to 100 participants with varying severities of depression to test the overall effectiveness of natural substances like fungi to treat mental disorders such as depression. And my reasoning for the longitudinal study is just because I think it's important to, like, yes, we saw that ketamine can have a positive impact on depression, but what are the long-term effects of using ketamine to treat depression? And so I think it would be helpful to look maybe 5-10 years down the line and what does that look like in patients with depression. And that is my presentation. Here are my works cited. Thank you.